Hi, this is Dr. Shelly here. I am a diplomat of the American Board of Obesity Medicine, and I am the host of the Back on Track Achieving Healthy Weight Loss podcast. So glad you're here today as we talk about what are the 3 things you need to know about Wegovy. Now, first off, Wegovy is an injection. It is a once weekly injection that you can insert in your stomach, on your thighs, behind your arms, are the major places where you do it. And you don't actually even see the needle. In fact, what you do with it is you just clean off the area with alcohol, uncap it, hold it down, and you're gonna hold it until you hear the second click. And as you see the yellow button goes down, you know it's completely has been inoculated, then you're done. Now, you wouldn't do it in your hand, okay? I just did that so that you can see it. But you would do it in your stomach, on the upper part of your thighs, the fatty areas, and behind the arms where it has a little bit more fatty tissue. And so the good thing is you don't see needles. For those who are afraid of needles, you don't see a needle. In fact, what you feel is the pressure from you pushing down. So, and then once you're done with the pen, you throw it away. That's it. You're done. So you get 4 pens per box. Now, the other thing you should know about it is what to look out for. So with Wegovy, it does, with all medications, there are side effects, but with Wegovy, you need to watch out for some nausea, vomiting, stomach upset. Some people can have diarrhea, some people can have constipation. It just depends on the person in your body. And so it's important that you are aware. Sometimes I find that when my patients do get a lot more nausea with the medication, we change the site of injection. Instead of doing the stomach, we may do the top of the thighs or behind the arms, and it helps reduce their nausea. And the other thing you should look out for is that with Wegovy, you got to start slow and kind of taper up. And so they have 5 doses, 0.25, 0.5 milligram doses, 1 milligram dose, 1.7, and then 2.4. And so it's important that you start with the lowest dose and taper up slowly, because I don't want you to be like one of my other patients who was given accidentally a 1.7 milligram dose, and she ended up vomiting and having nausea because she had such a high dose. So it's important that you make sure that you talk with your physician, your doctor, your pharmacist to make sure you're getting the right doses for you and you're able to taper up slowly so that you can avoid side effects. Now, if you want more information, feel free to check me out at the Back on Track Achieving Healthy Weight Loss podcast. And if you have any questions for me to answer, feel free to leave a question in the comments and I will make a video just for you. All right, we'll see you next time.